anesthesia and analgesia used in von Willebrand disease. As I already mentioned, there are three types of this condition. So in case of type 1, if it is normalized by the factors or von Willebrand factor replacement, we can use central neuraxial blockade. However, in type 2 von Willebrand disease, we have to avoid neuraxial blockade unless the levels are more than 0.5 international unit per ml, whereas we have to avoid the neuraxial blockade in type 3 von Willebrand disease. For the type 2N, we have to avoid the neuraxial blockade unless factor 8 levels are more than 0.5 international unit per ml, and IM injections or NSAIDs are only used if the levels are more than 0.5 international unit per ml. Postpartum management, von Willebrand factor and factor 8 should be more than 0.5 international unit per ml, and this level should be maintained for 3 days when the patient underwent a normal vaginal delivery. However, if she underwent an instrumental vaginal delivery or C-section, the level should be maintained for 5 days. Use of transamine in the postpartum period should be considered. We should give 1 gram of transamine 3 or 4 times a day for 7 to 14 days, but we can also extend it to 2 to 3 weeks or more if it is required. For thromboprophylaxis, we can consider low molecular weight heparin if the von Willebrand factor by RCO ratio is more than 0.5 international unit per ml, and if not, then mechanical thromboprophylaxis like TED stockings, pneumatic gaiters, or even increased hydration and early mobilization. These methods should be adopted. For type 3 von Willebrand disease, treatment with von Willebrand factor concentrate should be done for 2 to 3 weeks following delivery. The neonatal management should be that every pregnant woman should have this in her management plan of pregnancy, that we will test the neonate for diagnostic testing. This is done by cord blood sampling mainly for type 2 and type 3. Type 2 and type 3 von Willebrand disease factor babies should be given oral vitamin K rather than IM, and the type 3 should be considered for cranial imaging as well as short-term prophylaxis by the help of concentrate if there is a risk of trauma at delivery. So thank you very much. It was all about von Willebrand disease.